Assalamu alaikum. Thank you for visiting Rabbani Research. We will talk on health equity today, and let's see what we can learn from this. This presentation is based on the article Employers Can Do More to Advance Health Equity by a number of authors from Harvard Business Review, January-February 2023. And these are the authors: Shantanu Nandi, Lisa Cooper, and Ellen Kelsey. COVID-19. One of the starkest lessons from the COVID-19 pandemic has been the deep health inequalities and inequities as well. Nearly everywhere, groups that have been economically and socially marginalized experienced higher rates of COVID-19 and morbidity and mortality from infection. COVID-19 wasn't an anomaly, it was a magnifying glass. It exposed inequalities that persisted before the pandemic in life expectancy, birth outcome, maternal health, chronic disease prevalence and outcomes, and many more. What is health equity? Health equity is a state in which every person has the opportunity to attain his or her full health potential, and no one is disadvantaged from achieving this potential because of social position or other socially determined circumstances. The business case for health equity. Some business leaders may ask, why isn't health equity solely the responsibility of the government or the healthcare delivery system? Why must my business play a role? The short answer is that income, economic stability, workplace benefits such as paid time off and medical benefits, and social conditions in the communities where companies operate are major drivers of health disparities, and employers can play a lead role in addressing many of them. Studies conducted by McKinsey over the years show that companies with the most ethnically and racially diverse workforces or executive teams are more likely to financially outperform others. A BCG study found have also found similar results. Inequities in health. Inequities in health can also lead to groups of employees missing workforce often or being less productive at work. The same McKinsey study found that if employees who are black, Hispanic or Latino and Asian were able to meet their own health needs and those of their dependents while missing the same average number of days as white employees, the US economy could expand by around 20 billion, the equivalent of as much as 10% of the total cost of absenteeism. Health disparities also contribute to 93 billion in excess medical care cost. Beyond investing in diversity, equity and inclusion, here are the major opportunities for all employers regardless of size or geography. Opportunity 1. Optimize benefits and health plan offerings. Some plan designs may inadvertently exacerbate health disparities. One example is co-payments for emergency room visits. Because people from groups that have been marginalized face barriers to accessing primary care, they may rely on emergency room for routine medical care. So, cost sharing efforts may inadvertently worsen health outcomes for employees most at risk of serious complications. With careful plan design, employers can improve health outcomes. In a randomized clinical trial whose results were published in the New England Journal of Medicine and Health Affairs, patients from racial and ethnic minorities groups whose employers covered all the cost of their preventive medications after they had suffered heart attacks had 35% fewer major complications than patients with co-payments and 70% lower total healthcare costs. In 2021, in response to concerns over rising rates of black maternal and infant mortality nationally, Walmart expanded benefits under its medical plan to include up to $1,000 in coverage for doula services. Doulas provide emotional and informational support and guidance to mothers during pregnancy and birth. Aware of research demonstrating that having doula on a birthing team decreases C-section by 50% and the need for other medical interventions by over 50%. Opportunity 2. Address social determinants of health. Decades of scientific research reveal that 80% of health outcomes are determined by income level, educational attainments, health behaviors, and environment. The 2021 McKinsey survey found that 65% of the full-time employees of large US employers had experienced at least one unmet basic need. This suggests that employers should invest in benefits and policies that are not traditionally considered part of medical coverage, but that indirectly improve health by addressing barriers to achieving optimal health. Opportunity 3. Expand primary care and mental health access through virtual care and community partnership. 87 million Americans reside in communities that lack sufficient numbers of primary care physicians and mental health providers. In addition, many more are impeded from accessing care by barriers such as daytime work, lack of transportation, inadequate child care, and physical disabilities. It is important for employers to evaluate the virtual services offered by their health plan networks and invest in solutions that offer care that is culturally informed, contextually appropriate, and socially concordant, that is delivered by clinicians who share a social identity with the employee. Inequities in the US health system cost approximately $320 billion annually, and if left unattended could cost $1 trillion or more a year by 2040. Opportunity 4. Make benefits and healthcare easy to navigate. The 2021 McKinsey study found that employees of color were 1.4 to 1.5 times more likely than white employees to find the resources and tools explaining benefits unhelpful regardless of income level. A slightly higher proportion of individuals who use the service, that is 36%, have language barriers than those who don't, which is notable because the trend at similar health care services is the opposite. Marginalized individuals utilize them less. Charting the path forward to improve health equity among their employees and communities, businesses will need to invest in a multi-year effort to and equip themselves with the right leadership resources and processes. Here are the key steps for getting started. Build a business case for investment. While many businesses may look at health equity as a societal and ethical imperative, they should also quantify the impact of health disparities on their bottom line to justify their investment. What is the impact of health disparities on medical costs or premiums? What is the cost of absenteeism resulting from them? How would improvements to marginalized populations experience with care help recruitment and retention? And relatedly, how is a lack of diversity affecting productivity or the customer experience. Too often, health equity is looked at as a vague commitment rather than as a business problem with defined objectives. Research by Deloitte Centers for Health Solutions and the Health Equity Institute, published in 2022, found that inequities in the US health system cost approximately $320 billion annually, and Deloitte has partnered with World Economic Forum to launch the Global Health Equity Network, which has worked with more than 20 organizations in healthcare, life sciences, civil society, finance, technology, and other sectors to understand the impact of health inequities on their business. Similar analysis using toolkits such as one developed by the American Heart Association can help companies build the business case for sustained investment in addressing health equity. Collect data to understand the problem. Core to formulating a health equity strategy is understanding the specific health and social needs of your population. Many employers historically have not collected routine data on gender and sexual identity and face limits on how they can use self-reported race and ethnicity data. To address this gap, health and well-being assessments such as annual health risk assessment and employee surveys should be expanded to include self-reported race, ethnicity, gender and sexual identity, along with information on social determinants of health. For instance, the Center for Medicare and Medicaid Services developed a 10-question instrument that screens for social needs including housing stability, food insecurity, transportation needs, utility needs, and interpersonal safety that could serve as a useful starting point for other organizations. To make the collection of this data more acceptable to their employees, organizations should explain the reason for gathering it, make these fields optional, protect privacy, and assure employees that the data will not be used to discriminate. Identify an initial population to focus on. Prioritizing a specific marginalized community and a specific health problem is more effective than taking a blanket approach to improving health equity at the outset. Each employer has different challenges and opportunities that should inform which populations and medical and social conditions to go after first. Walmart chose to prioritize maternal health outcomes because national data showed that black women in the United States had higher maternal mortality rates than white women. It homed in on Georgia because the proportion of its associates who are black is higher in Georgia than in other states. United Airlines chose to address challenges that its African American and Hispanic employees in the Houston area faced in accessing health care after studying its own healthcare utilization trends. Engage a broad group of stakeholders to design solutions. A core principle in health equity is when designing solutions to a particular problem, you should focus first on the most marginalized individuals with that problem. Solutions that work for them often will work for everyone, but the opposite is rarely true. In designing solutions for specific problems, employers should get the input of individuals from the marginalized communities in question. One way to do that is to partner with employees resource group. These are voluntary employee-led groups made up of individuals with common interest, backgrounds, or demographic factors such as gender, race, or ethnicity. They often support new hires during onboarding and ensure that diverse employees have an opportunity to be heard, valued, and engaged in company decision making. Businesses should also consider establishing a community advisory board whose members include representatives of various community or organizations and neighborhood. Measure progress to drive accountability and build momentum. Too often, health equity is looked at as a vague commitment rather than as a business problem with clearly defined and measurable objectives. The result is a lack of accountability and over time a loss of sustained commitment. The right approach is to start by identifying a set of metrics, establish a clear baseline, set a time bound target for improvement, and track the metrics regularly. For example, when United Airlines and Accolade launched the Virtual First program in Houston, they agreed to measure the percentage of employees and dependents facing one or more barriers to care who utilized the services each month. While the ultimate goal is to improve health outcomes, though those outcomes are often hard to measure or at least attribute to a specific solution and are actually lagging indicators of success. Instead, employers should use a range of metrics, including those that provide real-time and actionable insights into the effectiveness of their programs, such as engagement and utilization. Commit to advancing health equity. To help formulate and communicate a strategy for improving the health of their employees, some employers have already adopted a framework used by many healthcare systems called the triple aim or the quadruple aim. The former has three overlapping goals for healthcare improvement and innovation: improved population health, better care experience, and lower costs. The latter adds greater job satisfaction among care providers. We believe a fifth goal, health equity, should be added for two reasons. First, if organizations don't consider health equity, they risk investing in interventions that inadvertently worsen health disparities. For example, co-pays for ER visits may lower total cost of care, but at the expense of reduced access for individuals living in areas with a shortage of primary care physicians. Second, if organizations don't consider health equity, they risk ignoring interventions that primarily improve it, such as providing discount prescriptions or access to food pantries. Recommendations. We recommend employers adopt the quintuple aim as a framework for making decisions about the design of benefits programs and for communicating to their employees and stakeholders their strategy to advance health and health equity. The health, productivity, and diversity of employees are key to an organization's success. The pandemic has magnified the wide inequities in health that prevent certain employees from achieving their optimal health. By using a health equity lens and proven strategies to eliminate disparities, employers can improve business outcomes, create a better employee experience, and advance health for all. Wish you best of luck. We are business consultants based in Pakistan. If you need to accelerate your organizational performance and transform the company to meet the upcoming business challenges for a better tomorrow, please contact us for a turnaround. You can find us at rabbaniresearch.net. Trust Rabbani for quality competence. Thank you so much.